Hello, cruel world. My name is Dr. Shaham Das. I'm a consultant forensic psychiatrist and NHS doctor. I assess mentally disordered offenders for a living so that you don't have to. You can call me the ominous Shahamanus. Okay, so this video is going to address, can watching certain documentaries cause PTSD, post-traumatic stress disorder? So obviously I'm talking about gory, scary kind of documentaries that show horrific offences. So, for example, Jimmy Savile's A British Horror Story. Will that cause PTSD? And also, just in that vein, as you might know, there's a drama, a true crime drama about Jimmy Savile called The Reckoning, a dramatisation of his life that's due to come out later this year, featuring Alan Partridge. Okay, before I answer the question about whether it can cause it, let's very briefly go over the core symptoms of post-traumatic stress disorder. So I've diagnosed this in my professional work hundreds of times, and I'd like you guys to know because I'd like to educate you. So what are the core symptoms? There's re-experiencing the trauma, the original trauma itself, through intrusive, distressing recollections of the event. So this usually comes in one of two forms, either flashbacks or nightmares. So I really want to stress that it is actually reliving. It's like going through the entire experience. It's like being transported back in time. It's not just intrusive memories, and often it gets confused with intrusive memories. So sometimes I see people that don't have PTSD but think they do because they have had a trauma, but they can't forget about it as opposed to re-experiencing it. So there's a distinction between the two. Moving on, another core symptom, emotional numbness. So that is exactly what it sounds like. You struggle to feel most emotions. Number three, and a really important one, is avoidance. So avoidance of people, places, activities that remind the sufferer of the original trauma because it might trigger the reliving, the flashbacks. The other thing is increased arousal, such as difficulty sleeping and concentrating, feeling jumpy, being easily startled, otherwise known as hypervigilance. Just very briefly, there are associated symptoms that are not core symptoms but often happen, like inability to trust people, decreased confidence and self-esteem, social withdrawal. Some people with PTSD, they avoid normal activities. They might use drink and drugs to kind of self-medicate. They might have paranoia, these kind of things. So that's a bit of background for context. What usually causes post-traumatic stress disorder? So it has to be an extremely traumatic incident. So typically it might be a victim of war, victim of physical abuse, sexual abuse, watching a Dr. Grande video, getting robbed at gunpoint, being in an extremely serious, like life-threatening car accident. Just as a quick aside, the weirdest thing that I've seen personally that's caused PTSD was a civil case that I did where somebody had routine dental surgery and she was extremely nervous about the whole surgery. And the anaesthetist actually mixed up the medicine, so they put in the muscle relaxants before they put in the actual anaesthetic. So what that meant is that the patient was conscious but couldn't move and couldn't speak, and she thought that would happen for the actual entire surgery, and it was quite big root canal surgery. So she didn't know that the anaesthetic was coming. So in that moment in time, she was absolutely petrified and thought she was going to be tortured basically in her head. And I think, having examined her symptoms, she genuinely did develop post-traumatic stress disorder. Just thought I'd mention it because it's quite an unusual case. Okay, so it's enough blabbering. Let's get on to the main crux of the question of this episode. Does watching really traumatic documentaries, stuff like Jimmy Savile, does it cause PTSD? To answer that, we need to look at the definition in the ICD. So if you're interested in psychiatry or psychology, you probably know the ICD is called the International Classification of Mental and Behavioural Disorders, and it is the most commonly used classification system in England. Americans tend to use DSM. So post-traumatic stress disorder, the definition is in the ICD-10, and if you want to impress the ladies, it's coded as F43.1. And the reason I'm telling you the definition is because it kind of answers the question about whether watching these documentaries is relevant. So I'm quoting for the ICD-10. PTSD arises as a delayed and/or protracted response to a stressful event or situation of an exceptionally threatening or catastrophic nature, which is likely to cause pervasive distress in almost anyone, e.g. natural or man-made disaster, combat, serious accident, witnessing the violent death of others, being the victim of torture, terrorism, the R word, which I don't want to say. Okay, so the reason I told you all that is because I don't think that watching a documentary, Jimmy Savile or any other thing, can be classified by the average person as an exceptionally threatening or catastrophic nature. Not for most people. We're not talking about 2 pints of lager and a packet of crisps. However, and this is a big one, this is the take-home message, if somebody has previously experienced sexual abuse, then watching this kind of thing can trigger it. So it's really important to make the distinction. Hopefully I'm getting it across well. So what I'm saying is the TV show, the documentary, can't cause these triggers. Can't cause these symptoms. It can't cause this disorder. It can't make you suffer all those things that I was talking about in the first place. But if you already have it, then it can trigger those symptoms. So when I say trigger that symptoms, it might be able to cause a period of low mood, might be hours, might even be days, might cause a panic attack or trigger flashbacks, as I said before. And the more it reminds the victim of the original abuse or abuser, the more likely it is to trigger. So in this context, obviously, actual victims of Jimmy Savile would be much more likely to be triggered by watching a documentary or a drama about him. Now, the eagle-eyed cherries amongst you might have noticed that one of the core symptoms I said before, was the avoidance of people, places and activities that are a reminder of the trauma. So if this is a core symptom, then you could ask the question, well, surely they'd be avoiding the Jimmy Savile documentary. Why would they be watching it? And my answer to that would be, yeah, but people with mental illnesses do things that are detrimental to their health all the time, just like people who don't have mental health illnesses. You know, people make bad decisions. I know I certainly have. I imagine you have, and I mean you specifically. For example, people who suffer from depression shouldn't drink alcohol in the long term, but I've seen many patients that do this. People who have a tendency towards psychosis, they might have schizophrenia themselves or schizophrenia in their family, sometimes take drugs, which make them even more psychotic. I've literally seen patients who have previously had drug-induced psychosis several times, become really unwell, ended up being sectioned, and they go and do it again. I don't know why, peer pressure, because there's some pleasure in taking drugs. Anyway, I'm going off on a tangent. If you're interested in drug-induced psychosis, by the way, come and see my dope video about a Wu-Tang Clan affiliated rapper who ended up getting drug-induced psychosis and cutting off his own genitals. I kid you not. Okay, so those are my brief thoughts on the topic of whether or not watching gory documentaries, traumatic documentaries like the one on Jimmy Savile can cause PTSD. If you're interested in Jimmy Savile in general, then what's wrong with you? Check out my videos. I've done an entire psychoanalysis of him. I've talked about the very idea that he was allowed to run riot in Broadmoor. And if you're interested in PTSD, I've done a video on PTSD versus complex PTSD. I'm giving you so much. What else do you want from me? Okay, have a blessed day. Stay euthymic. Buy my goddamn book. Do not forget. I love you.